today's event. We would like to welcome you to Together We Can Heal. Together We Will Heal forum that has been organized by the Central Texas African American Family Support Conference. The conference vision is to educate the African American community on mental health, substance use disorder, and intellectual and developmental disabilities, as well as total well-being of African Americans. We hope that this forum will provide the opportunity for you to participate in conversations that offer education, encouragement, and resources. So here are a few housekeeping rules. We ask that you would always keep yourself on mute. There will be a time, of course, for interaction. You may raise your hand virtually and unmute yourself to talk when you are called. And you can put any questions that you may have inside of the chat. If you get emotional or overwhelmed, we ask that you would please turn off your video so that you may handle your emotions privately. If you need to talk with someone, please call Integral Care 24/7 hotline at 512-472-4357. Note that we will be recording this forum, and it is also live streaming on Facebook. So y'all just smile every now and then, right? Okay, so today's conversation is about mental health and IDD resources for Texas. The Texas Council for Developmental Disabilities, TCDD, is funding the index program at the UMass Chan Medical School for a comprehensive study of the service gaps in the mental health care for people with development disabilities. The project will include a survey of self-advocates and will identify strategies to address service gaps. The project will also develop a framework to direct future research into mental health care services for people with developmental disabilities. The framework will also inform decision makers in prioritizing future programs and service based on areas of need. So the project will create an online resource for mental health care information and referrals for people with developmental disabilities and service providers. So today we have here to chat with us to this complex mental health needs and people with IDD project are John Rochford and Benjamin Amankwata. I hope I pronounced that right, Benjamin. So John is a program director of Index at the Eunice Kennedy Shriver Center and faculty member at UMass Chan Medical School in Rochester, Massachusetts. He wears many hats, such as an expert for the World Wide Web Consortium, a member of the American Expert Speaker Program, U.S. Department of State, and a technical advisor for the Institute of Economic and Racial Equity at the Heller School of Management, Bradus University. He helps to make the web usable for people with disabilities because easy to understand text is important for people with cognitive disabilities. Non-native language speakers, people with low literacy, older adults, and really everyone. Some people with intellectual disabilities and or autism. Then we have Benjamin, who is currently a doctorate candidate in computer science at the University of Massachusetts. He's researching owl and recommendation systems. His passion is creating technology that levels the playing field for individuals of all abilities so they can unlock their full potential. At the UMass Medical Center, he designs and builds scalable web systems with accessible user interfaces and conducts research in artificial intelligence, AI, centered around text simplification. Welcome everyone, and we really appreciate you for being here. So let's dive in. I believe they're going to start with a PowerPoint. Am I correct, John?
Yes, you're correct. And thank you, Coach D, for that wonderful introduction. I'm hearing an echo. Is it just my side? Can you guys hear me?
Yes.
Hear you.
Wonderful. So let me share my screen and just start with just a few remarks. Um, so my name is Benjamin Amankwata. It is a pleasure, an honor, and a privilege to meet you guys today. I've been very excited about this conversation, and I hope that our hour and some together today will prove to be productive and useful for all of us today. Thank you again for inviting us. So there's a brief PowerPoint presentation to shape the tool that we're going to demonstrate today. And this PowerPoint presentation is designed around questions that we got from from your organization. So I think the first question has to do with what is this project and what is it about? And so I've captured here a summary from this project document that I think talks really eloquently about what this project is about. And in a nutshell, people with intellectual and developmental disabilities do not receive the mental health services that they deserve because they are discouraged by significant barriers, and we are trying to encourage them to obtain mental health services by reducing barriers related to isolation, agency, literacy, and transportation. And this project really engages self-advocates in an integral way in every aspect of development. So what is the CMHN project? It's an initiative that's funded by the Texas Council for Developmental Disabilities, as Coach D has mentioned, and the focus is on intellectual and developmental disabilities. In this project, we worked really hard to learn as much as we could about, the mental health needs of people in Texas with IDD, and to find resources that could help them. And we've developed a significant database with resources that would help people in that community. On your right is just a snapshot of the project site, which we will be delving into briefly. I'm going to try to keep an eye out for time because I want us to actually get to the demo of the project. So if I'm moving too quickly, please slow me down, but I want us to get to the meat of it as soon as we can. So who are we? John and I belong to an organization called Index. Index is now a subsidiary of the University of Massachusetts Medical School. And Index for over 3 decades has been involved in this business of getting people with intellectual and all kinds of disabilities access to quality information that we've curated since 1986. I'm going to give John, if you're available, an opportunity to say something briefly about Index, and then I'll move on to the next slide.
So Index is a project of the Eunice Kennedy Shriver Center. You may recall that Eunice Kennedy was really integral with writing the legislation that we all enjoy, and her brothers, JFK and others passed that legislation, but she wrote a lot of it. And she also started Special Olympics. You may remember her from that. So we have a long history at the Eunice Kennedy Shriver Center with research, education, and service to and for people with intellectual and developmental disabilities. And the Index program is known in Massachusetts as the information service for people with disabilities. And we may show you that website briefly, but if you the web address at the bottom of this slide is that website, disabilityinfo.org. And we have over something like 70,000 healthcare professionals, 60,000 doctors among them, and 7,000 programs and services, and all kinds of great information for people with disabilities. And as far as we know, we are the best information service of any state in the country. And I hope, I have a dream that we can bring that to Texas And we're doing that in part right now with all of you in the mental health space. So we may talk about that later. And that's it. Oh, hey, I got to tell you one more thing. I'm so sorry. Ben, I don't know if you can show the like the about page for Disability Info, or so I want to show you a picture of our team. So while Ben is doing that, it's right on that page. Yeah, it's on that. So while Ben is doing that, let me just tell you how proud I am of our team, because for all kinds of reasons, smart, hardworking, passionate people. But as you'll be able to tell from the picture, we're a very diverse team. We come from many countries, many ethnicities. We're people with disabilities, and I couldn't be prouder of the team of people that are at Index, and we would have no success at all without all of their hard work and passion. Okay, so now I'm done.
Thank you, John. So I think one of the questions that came up was, what do we mean by complex mental health needs? And so I think the simple answer to that is that, mental health is complex enough as it is, but for people with intellectual and developmental disabilities, there's an additional layer of complexity which comes from issues with people not always being sure what is happening to them, or what is needed to rectify it, or who to turn to for help. So the complex and the additional complexity there really has to do with the additional layer of mental health challenges for people with intellectual and developmental disabilities. And we can delve into that later if people have questions at the end of this little presentation. So another question that came up is, why is there a need for a resource like this? And so, I mean, the key reasons obviously are, one, to fill the gaps in finding mental health care, and also to address special issues like family stress, trauma, PTSD, domestic abuse. But we wanted to have an always available resource where people with IDD can independently find the help that they need. And John has spoken briefly about Index, but we've been in the business of doing this for over 30 years. We have information and referral specialists who are people essentially that for years at Index man the phones and would talk directly with people with intellectual and developmental disabilities and mental health issues. And so we've come over the years to accumulate real insight into the kinds of needs that those people have that sometimes do not necessarily overlap neatly with the general population. So what are some of these needs? One is that it's important for this community to have a central place where they can collect all the information that they want, instead of having to go to get snippets of information from different, locations and websites. And Another insight that we learned from them is that for this community, proximity to public transportation is very key, because a lot of times people like that are not able to drive themselves to places, or they need assistance, or they work with their caregivers. So our resources factor that into consideration. Also, insurance and payment options and the significance of free services is very important to the community. And also, not just thinking about the community, but the guardians and the caregivers of these individuals and their needs and considerations. And also the fact that there's a lot of overlap between people in the IDD community, and also the need for special physical considerations, wheelchair access, ramps, and stuff that is not necessarily immediately obvious to people that don't work closely with them. But with our experience doing this for over 30 years, we take all these factors into consideration when we present resources, and we're looking for resources that we give to the community. So another question that came out is how accessible is the website for people who speak other languages besides English and Spanish? And we will touch more on this when we actually do the demonstration. But we have a feature to be able to translate the content into different languages using Google Translate. But we also specifically, make some of our resources available for this Texas project in Spanish, and we're looking to expand into other languages. Our websites also have specific considerations for people with visual impairments, low vision or no vision. And so we have widgets to expand text. We have widgets that will read out the content of the resources to you. And we will demonstrate some of these things once we get to the demonstration part of this presentation. Engagement with providers and community. And again, I'll talk about Index. For years, Index was one of the principal components of an organization in Massachusetts that organized providers in the community and people that served IDD. We had an organization called the MNIP for a long time that would work and coordinate with providers of this community to try to work out ways to facilitate how to help them. And John, this might also be a good time for you to talk a little bit about engagement with providers in the community, if you want to say a word about that.
Sure. Well, what's important here is what we're doing now. And that really is why we're here with you today, is because we are collaborators and we know that we don't have the knowledge and lived experience that you have, and we need your help to make this a successful effort for the people we love, and not just for getting it all started, but also for making sure it stays around. Because a problem with projects such as these is that funders, such as the Texas Council for Developmental Disabilities, will give you funding to start a project, but funders don't give you funding to keep that project going. And so another thing that I'm hoping to engage with you about in the future is what it might cost to keep the project going and what your thoughts are about how we could do that.
Thank you, John. So we're just going to jump straight into the demo because that's I think what we're here to show you primarily, and then we'll come back to the presentation if need be to answer some more questions. So I'm going to exit the presentation now, and we're going to go to the website. Can everybody see the website okay? I'm going to try and zoom in a little bit to make it bigger. Coach D, if you could just let me know if this is visible to everybody correctly.
Yes, sir. I can see it.
Wonderful. And then if anybody can see it, please hit up Coach D with a message, and then if there's anything I can do on my end, we can get into it. So this is the project website. And so I'm going to navigate a little bit based on how the resources are organized. So the first resource I'm going to talk about is crisis.
I'm sorry, Ben.
Sorry, John. Yep.
I'm sorry to interrupt, Ben, but
Yeah.
It's important for all of you to know that this website has not been launched yet. We have not made it available to Texas citizens. And so we're asking everybody to just keep it. We're showing you an early version of it because it's a work in progress. And so I'm just letting you know.
Thank you, John. Yeah, that skipped me. So you guys are getting early access, exclusive access at this time to what is yet to come. Um, we still need to work out some kinks, um, but even in its current state, I think it has a lot of value to show. So the first group of resources here is crisis management, which obviously needs no further elaboration. So on this side here, you have access to information for anyone in crises or anyone that needs immediate help. Um, we have a map where you can find crisis resources, and I'm just going to filter here by Austin, which I believe is where most of us today are located. So we have a list of resources here in the Austin area, and we have a map that you can navigate, and um, a list of resources that you can link to. John may want to say a few things about some of the accessibility considerations that we have on this particular page. John, if you want to, I can talk about it.
Sure. So one thing you'll notice right away is that we show in our search results the contact information for the service. Most people, that's really all they want. Ben will show you later records that have more information about that service. Another thing you'll notice is that we have right up front the last time the record was updated. And that's important to know because the only good information is up-to-date information. And so we're letting people know how up-to-date it is. And another thing is we are presenting some accessibility features here, such as the little symbols that are next to the text to help explain to people what that information is about. And Ben will show you other of these kinds of features. And another thing is that Ben, if Ben were to show you one of these services, of course, Google Maps will give you driving directions, but also will give you public transportation directions and even walking directions, bicycling directions. So that's all I have to say for now.
All right, sounds good. So I'm going to go into one of the records so you can see how the record looks. So this is a full record. If you go into the record, it has the contact information. It has the narrative. You can still go to the map location, go to their website. You have information about cost. You have information about insurance. You have information about specific populations that are served. You have information about age groups, fees, and all of that. So the records are really meaty. They have a lot of information, and you can if you're a provider, we will talk about this at some point. You can submit information that will be reviewed that could end up updating this record. But you could also send us comments about this service if you know about it. That information is not going to be made public, but it will inform us in the background about the nature of the service. So that's for crisis resources. The next group of resources here would be what we call our advanced search resources. So essentially, in this scenario, you can type in information about different types of services that you want and run a search on that. So in this case, I'm searching for free services. And after I search for that, I can always filter back to my location of interest. Again, we'll pick Austin for obvious reasons. And you get a list of records that you can go into, but in the sidebar here you have a list of options to help you filter down these resources by Medicare, private insurance. So there's all kinds of filters here to help you narrow down to what your specific needs are, what you're looking for. Um, So next, I'll talk briefly about um, the Spanish language resources. So we have information that has been made available in Spanish. So this is high quality translated information because we know that not everybody in Texas speaks English. But additionally, we also have this plugin here where you could essentially translate to different languages. We know in Texas, after English and Spanish, that Vietnamese is the next most popular language. So you can translate this into Vietnamese or Chinese or whatever language that is available in this list to translate. Um, and now I need to go back to English because I don't speak Vietnamese. Um, so um, so that's the main level of navigation, and then we'll go into service specific types of resources. So here we have counseling resources, and again, all these resources can be sorted out um, by town. You can also search by um, distance within the town, or you can search in a square mile radius, whatever um, whatever your specific um, needs are. So um, this is helpful. I think in smaller towns where you may not necessarily have a bunch of resources exactly where you live, but you want to find stuff that is within your range of access. Same also applies to this. We have behavioral health services. So
Ben, could,
yeah,
Ben,
go
could
ahead.
you talk about I'm sorry, the other thing I want to say here is that we have added all the telehealth resources we can, because we know that, most of the state is rural and most of the state doesn't have access to services, that you can get to even within an hour. And so telehealth is going to have to be the way for many people to receive services. We've added as many of those as we can find.
Thank you, John, for bringing that up. And that's actually been a key design consideration, especially since the pandemic. Um, so telehealth is becoming a very significant branch of our resource groupings, and we have more features, down the line for that particular type of service. It's another group of resources that we have. So at this point, I think you kind of get the picture, and so I'm not going to be repetitive here unless there's something specific that will come up during the Q&A that we'll want to talk about. In addition to the translation services, I think there's a question about other types of accessibility. So we have this toolbar here. This literally went up, I think, last night. But I would refer instead, I think, to what we have on our. This is our kind of not kind of. This is our flagship resource for Massachusetts, where we do something similar. So we have this resource that allows people with low vision to help create contrast on site to make it easy for them to read, and we're integrating that, or we will be integrating that fully into the site. We also have text toggle features, so you can make everything on the site bigger or smaller to what your needs are. Also coming soon is a text to speech capability, which we currently have on our Massachusetts site. That's going to be coming. So essentially, if you click on this, it will start to read the entire. I don't know if you guys can hear that, but you see that the page is read out, and then the text is highlighted, and it actually shows you which word it's saying. So that helps. I use that even sometimes. Sometimes you get, your eyes get burnt out from reading all day, and so these are all the features and accommodations that we are building in. And again, as John said, the goal is to make this a site where people who use this information can independently, on their own agency, come and find the help that they need with things that's empowering, with things that's important, to to what we do. So I'm going to then return to the presentation to where we left up. So what's coming up the pipeline? John started talking about this a little bit, but in the spirit of agency, the idea is to bring the stories of advocates themselves to bear, to encourage other advocates to use these resources to enhance their agency. We're thinking about a rating system so that services and programs that do exceptional jobs at serving this community can be recognized by a high rating, and that will also encourage people to know which services are worth their while. We want to create a review creation capability to let people know what the experiences are using the services. And very significantly, it's not just enough to put the information out there. We're working on content simplification, making both the language and the structure of the information simple and easy to consume and digest for people in that population. In my bio, mentioned something about this is a line of research that John and I do, where we're looking at using artificial intelligence to make language and content simpler for this community. And then obviously trying to add more providers and grow the database. And finally, I mentioned this earlier, emphasis on low transportation content for advocates. So I think this would be kind of the end of the presentation. Yeah, go ahead, John.
Can you go back to the previous slide, please?
Yes.
Okay, so I'd like to talk some now about the rating system. We know that many mental health services in Texas are required by law to serve the population we love, and but do they? They say they do, but do they? And so the rating system that we're going to be developed is the first question that we're going to ask people is, did you receive service from this organization, this service? Did you receive a service? And yes or no. And then we're going to be working with self-advocates, and by the way, we pay them well to help us. They're our partners, to come up with a list of other questions and possible answers to help rate the quality of those services. And as those services are rated, then in the search results, the ones that are rated well will come up first, so that people, when they go to do searches, they'll see the ones that actually have made service, have provided service, and then how well they did. And I think we think that's really important, because it's a way to engage the community. It's a way to evaluate the services, and it's a way to determine, are people really being served? That's it.
Wonderful. So we're coming into the half hour. We just passed the half hour mark of this, and so since this is really meant to be a conversation, I think we're going to be ending this phase of it, and then Coach D, you can jump in, and then we can just have a conversation and answer any questions or go back to anything that people want to highlight. Thank you.
Okay. Thank you for that, Ben. I have one question, and it is, will we receive a copy of the slides so that we can go to the web links that was being shown?
So I can speak briefly about that, and John can talk more about that as well. Because this is currently in development, we do not have clearance from the funders to make this publicly available. We want to incorporate feedback before it becomes publicly available, which is the purpose of this conversation. But we are in conversation with you. You guys will be first to know when it does become public, and we will make that information available to you. But unfortunately, we do not have clearance from TCDD at this time to make this information available to the public, because the site is not yet finished. So unfortunately, that's kind of the situation right now. As far as the slides, John, you want to talk about that?
Sure, but I saw some information in the chat, some from folks that you can get to the website right now, and that's true. But what's going to happen is that after this chat is over, our team is going to change the address. We're going to make that the website not public. And then in terms of the slides, well, before I even get to the slides, what I want you to know is that we need your help. And so if any resources in the state that are, any mental health resources of, would be great if you would let us know of them, so that we can let the whole state know of them when we launch the website. And as well, we need as much participation as we can in the community. So any ideas you have about that, and we'll be giving you, you can go through Lady Jane. I think that's what we agreed to do. And Lady Jane will pass on to us your questions, your information, etc. And in terms of the slides, I hear you. You want to be able to get to the website. You want to be able to see more information. But I think that because I'm a little worried, simply because, as I said, as Ben and I have been talking about, I don't want to, let's see. So here's the way I think, and I've been doing this for a long time. We want the public, the people we're serving, to trust the information they're receiving and to have a good experience right away. First impressions are really important. And so we want to do the best we can to make the website present wonderfully upon the first impression. And so therefore, I want to be very careful about any information getting out that would make that not happen. So you can ask through Lady Jane any questions you want, but we're not going to be sharing the slides.
So John, I think are you there? So
no.
Yeah. So but in fairness, I think since we're sharing this, I think if you can speak in any way to what people can expect.
In
I
terms
think
of what?
When this information may
Oh,
become available. I
when
think
it
it's
will occur.
yeah.
Oh, okay. Yeah. All right. Yes, I will address that. And I have a couple other things I want to say. So where we are is, I think this is a 5-year project, and I think we're in year 4, perhaps. I may be wrong about that. But our latest proposal for funding included many new features for the website, some of which we've already addressed. And so when we have built those features, then that's the time we're going to release the website. Now, when that is, I don't know. So what I can tell you is certainly not longer than a year, and more likely on the order of 6 to 9 months is what I'm guessing. It depends on a lot of things, but that's the best I can do in terms of estimating a time. I also want to tell you that.
Let me just say, John, thank you for that. I know I put you on the spot. I would
Oh,
add to what he said is that we're working as hard as we can to bring this out as soon as possible, and so to whatever that
Okay, thank y'all for that. We have another question in the chat. We asked, how does one get their resources on the website? And is there a fee to have your organization listed?
I can speak to that briefly. John can speak more deeply to that. The fee part I can speak to, 0 fees.
Yeah. So I'm so glad you asked that question, because it makes me think about sustainability and in terms of financial sustainability. So one thing we haven't talked about is the future, and one of the things we're hoping to do is to engage the different kinds of organizations within Texas, such as aging service access points, such as independent living centers, agencies that provide mental health services, and say to them, we can put right on your website the mental health services that serve the people that you serve. And so because nobody is going to know about this website. We don't have any funding for a public relations campaign to let the state know about it, okay? But what people do know are the agencies that serve them. And so when they go to visit the websites of those agencies, they're going to be able to find mental health resources in their community, and they'll come to our website, this website, to learn about them, and hopefully that'll help get the word out. So that's one. And what we're going to be doing with those agencies is we're going to be saying to them, we're going to give this to you for free, okay? We're not going to charge you for this, but what we're going to do is ask in return that you keep up to date the records that you're showing on your website. Okay, you do that in the future, and that's going to be good for you because you'll have the latest information. And also, would you please add any resources that you know about? And basically, that's what we're going to be asking. So that's one idea for sustainability.
So let me say, so thank you, John, for that. I think we didn't necessarily answer another part of the question, which is how do you get the resource on the website right now? And so that would be that you can reach out to us, but it's also, I think, something that I've put down, John, to think about ways that people may be able to, in the future, just post suggestions. Sorry, go ahead.
Okay, so Ben, could you go to disabilityinfo.org for a moment? So we have a way for people to do that. I don't know if we've implemented it on this website, but I'll show you the way we do it in Massachusetts.
I'm still in the, hold on.
Okay.
What's going on here? All right, I'm going to stop sharing because Zoom is messing with mine, and then I'll share after I'm back in there.
Okay,
So
well, it's okay. You don't have to show it. So basically, we have a for providers section that says add your resource or add your, add your service. Here we go. And so you see the very first, I can't see the screen, but.
add your, yeah, no, it's what you're saying. Add your program or service for free, and then you can do that. You can literally do that. We don't have that on the Texas thing yet, which is why I'm putting it down for something to add in the future for people to create those resources there.
So I want you to know, Ben, if you could go to a physician search,
Sure.
that'd be good. So I just want to briefly tell you that we are incorporating all kinds of ways for people to independently find their resources, as we said up front. And that's so important because privacy, right? People should be able to find mental health resources and be private about it, and just like anybody else can. And that means that they need to be able to understand the information that that's being presented to them. And so we do a bunch of different things here. And one of them is, if you could look at open up specialties, Ben. So on disabilityinfo.org, we do some pretty cool things, like we do plain language definition explanations of physicians. So I can't see the list, but like heart doctor, parentheses, cardiologist. So people can see heart doctor right away and know what it is they're looking for, and then see the clinical term. And so that's the kind of thing we'll be doing. So an example of that is maybe somebody doesn't understand or know the word suicide, okay? And so maybe the way they know that is kill myself, okay? I want to kill myself. It's more likely they think that than they think I'm going to commit suicide. So the clinical term is, right, commit suicide. But so what we're going to be doing is, with the search tool on the home page, that and that's also on the other pages, is that we're going to be matching clinical terms to the terms that people really use, so that they can find the resources that they're looking for. That's the short version of that.
Okay, that's great. It's kind of like eliminating the language barrier and keeping it very, very neutral language, right? Very good.
Yes.
There's another question. Are primary care providers pulled into this? The patient-centered medical home, often basis healthcare improvement is an important step in mental health care, and primary care providers should be versed in first-line mental health care for their patients, even complex patients. And I believe y'all just showed where it was on your website, John, on the disability info website. I did see this, so I believe in this question is for the project that's being worked on right now.
So Ben.
Yeah. So the short answer is it's not currently in the project. So I think that's a suggestion that we can take back to the funders. Actually, as a segue, I would like if we could collect all these questions. I think they're all very, very important. But yes, it's not currently there. I think it's an important one, and so we're going to take that as a suggestion and
Okay.
bring that up to yeah.
Okay.
Thank you.
I have another one. It says, will the website include information about private organizations, nonprofits, and/or individual practices? And if so, who will be managing the website and ensuring that the contact information is correct and up to date?
Okay. So I'll take that one. So as I explained earlier, we're hoping that the agencies that want to present this information to their constituencies will keep the information up to date. And primarily, that's contact information. Even if the other information goes out of date, it's really the contact information that has to be kept up to date. And so, yes, to your point, that's how we're hoping to do it. And then another thing is that in terms of how we sustain, the most important thing is that we have all the resources we can possibly find. And one of the things I think we're weak with in terms of categories are individual clinicians, perhaps, private practices of mental health services that serve our population. And I imagine that's because there aren't many of them, but we would love to find them. And so if you know of any, please tell us.
Okay, I have another question. It says, what is the website called and how will we be notified when it's out?
We will notify you guys once it's out through the organization, through Lady Jane. We will let you guys know as soon as it's ready and how to find it. We'll send all that information out to Lady Jane or whoever your representatives are. So it's for you guys that it's been developed, and as soon as it's ready, we'll notify you guys about that.
And you can interpret Ben's "you guys" for y'all.
Yeah, okay. Once the website is ready, will providers be promoting it too in their offices, since that's where people will be getting services?
Well,
we hope.
I sure hope so. Yeah.
Okay. Will it have information for housing, where to find free insurance and transportation?
Okay. So yes, we are adding all the insurance information we can find and all the transportation options we can find. But regarding housing, no. And regarding all the other programs and services that people with disabilities can take advantage of in Texas, I said earlier that my dream is that we can offer to the state of Texas the same kind of resource that we do in Massachusetts that would include all those things. But I'm hoping that when the people in power, the people with influence, see this mental health resource and see it be so successful, that would be the spark that would perhaps enable us to bring a wider set of resources to Texas.
Thank you. And Lady Jane did say that anyone could reach out to her. She put her email in the chat, and that with CTAAFSC will keep everyone notified through a newsletter if you want to sign up for a newsletter. And then I'm quite sure once everything is ready, Lady Jane will send out that mass link letting everyone know that the site is up and running. I think that's it. For the questions, when you say to let you know the providers, okay, will the services be offered to all insurance agencies, or is this going to be limited to specific carriers?
The insurance information is what the provider tells us. So it's really something that we don't say who the insurance that the provider accepts is. So whatever they tell us they accept, So I imagine that would be everybody. if they accept it, then it's coming from the providers' records. That's information that the providers are given to us. John, no?
Correct.
Okay.
And that's a great question. And I have this question: will the insurance agencies that accept these services be listed on the website? I know on some sites it'll tell you the insurance that accept certain services and the insurance that don't accept certain services.
So what people will be are able to do on this website is they can search for services that their insurance covers, because they can search by their insurance. So that's where we're hoping. Well, let me backtrack a little bit. I think I'm a little confused. So right now, I think what we're doing is we're saying you can find all the services that private insurance covers. And we're not at the point where we're listing all the different insurance companies or agencies or entities that that Ben's talking about. A lot of providers have given us that information. And so we may be able to enable that feature as well, just like we do on Disability Infography in Massachusetts. But that's the best I can answer for now.
Okay, thank you. Lady Jane said that we are recruiting self-advocates to contribute about topics related to the following descriptions of the series. People with IDD talk about healthy sexuality and relationships. Sexual assault survivors share their thoughts. We support each other by raising our voices. And she put the link on YouTube where this can be viewed.
Thank you so much, Lady Jane. Yeah, we have 3 big projects in Texas for the population we love and serve, and one of them is all funded by TCDD, by the way. And one of them is sexual assault prevention and response. That's what it's called. We know that our population is assaulted at 6 times the rate of everybody else, and we've created a series of videos of self-advocates talking about their lived experiences, giving advice, and we need more. We need more people to tell us their stories, and so we're recruiting actively, and we would appreciate anybody who would want to do that with us. And also, you can go ahead and spread the word. That YouTube channel that it has those videos. We hope you like them.
Okay, any last comments? We have like 1 minute left. I just want to thank everyone and remind them to connect with us again every 3rd Wednesday of the month at 1:30. Please come to our Facebook page and like that. Lady Jane, can you put that Facebook page in the chat as well? So,
yes, working on it.
Do you have anything that you would like to say? You got a couple of seconds.
Yes, we just want to reiterate how, honored and privileged we are that you guys would spend an hour of your time with us. We're very, grateful. We appreciate everybody that came to listen, and we encourage you to kind of reflect on what we've talked about and think of ways that we can together, help this community that we care about. And we are just very grateful for your time and for inviting us. John?
I couldn't have said it better. Thank you, Ben.
Thank y'all. And these questions, we'll go to the moderators. So everyone will have an opportunity to engage this conversation, even off of this virtual platform. Thank y'all. Y'all have a great day. Until we meet again, be well and stay safe.